Hi guys, I'm Aditi. It's been couple of weeks that I have documented anything about BPD or mental health related since I was busy with some family reunion and functions and everything, and that was kind of ecstatic and overwhelming and intense on many level to think about anything else and uh, I'll definitely create one video about how the situation was and how I dealt with that, what kind of coping mechanism I could use then when I was in stressful situations, because it was kind of like intense on many level for me, be it the intensity of every emotion, be it happiness or sadness or fear, everything was on peak. So, of course, I needed some help throughout that week, and I'll talk about it more. The purpose of today's video is to talk about BPD and suicidal thoughts or suicidal actions or self harm, since it's September, also known as Suicide Prevention Month. And I, who has been at the darker end of the tunnel and who has attempted suicide or harm myself, felt terrible in those situations, and I thought it is important to be vocal about it, to create an awareness about it, that how certain things can look from a person who has BPD, from that person's perspective, and how the world sort of ends in that moment for that person, and how the external factors play certain kind of role, be it in preventing or be it in directly or indirectly encouraging the situation. So, first of all, I would like to tell it from my experience. Again, I'm telling this as a person who has experienced this. Maybe other BPD people might have different kind of experiences, and even if you don't have borderline personality disorder, you even might have suicidal thoughts if you are into a depression or any other sort of mental health crisis. And but this is, I'm talking from my experience. It was like I found myself in a situation where everything went dark for me. Like, I'm trapped in a dark room where I can't see, I can't speak, I can't hear, I can't call out for anyone's help, and I can't think. It's a brain fog, completely. There, I can't see beyond nothing. I can't breathe, and there is a lot of pain. And all I want in that moment is to end that pain forever. Because I'm so tired of being in that dark room for a very long time, and in that moment, all I could think to take a step where I'm ending my life, and I had no one to talk actually at that point of time, and I even attempted that thing. And of course, I was in therapy then, but I had not spoken about attempting any suicidal action. I always spoke about having suicidal thoughts, and this was the first time, I guess, when I told my therapist that this is the thing which I have attempted twice within a span of like 3 weeks or something. And when my therapist asked about if I have done certain things in the past, and as I started, looking back at my life, uh, it started, giving me some clarity that this has been my pattern since I was in seventh grade, and be it self harm or suicidal attempt. Uh, this has been the pattern, and it's a coping mechanism. If I feel abandoned, I feel lonely, I'm having some difficulty, I can't envision my future, the first thing comes in my mind to move towards these things, then looking for a good, better option to coping with it. And that's when one thing led to another. That's when I got my diagnosis slowly about borderline personality disorder. I'm telling this as a BPD person because the risk in BPD person is much higher about suicide than anyone else who doesn't have BPD. Sometimes it just can be a self harm, which can, escalate in suicidal action because they are BPD people have this tendency to react impulsively. Substance abuse, alcohol abuse, anything, or the mind always reaches to the extreme level of the things, and within a moment certain things can escalate on that level, and it can be risky. And if there is no primary system for that person, then it can be very hard to actually come out of it. And sometimes even so I was given this no harm forms to it's a contract between you and your therapist where you tell you agree to not harming yourself in any way. And for me that also didn't work because the moment I saw that I need some context to be given in that form, it was so difficult for me to think about even a single contact at that moment, which again took me to that trauma. And it was a weird feeling that I can't even think of a single person in my life where I can be, I won't hesitate to tell that person that this is what is happening with me, and all I need is your help, to ask for a help. So, everything backfired on me when I attempted kind of suicide. My friends who certain friends thought that I'm trying to seek an attention by doing all this, and they were like, they shut me off completely because I don't know, maybe they thought I'm some kind of crazy person or anything. But for many people, even till the date, when someone talks about committing suicide or anything, the first thing they get to hear is they are trying to seek any kind of attention, which is not the case for you. It is seeking an attention, but I call it cry for help, because that's what we have been doing, but we don't know how to ask for the help in that moment, because first of all we don't get it that what is exactly happening around. And uh, I was abandoned time to time for this by my friends, and nobody thought of coming in person and keep a check on me. Instead they prefer to party somewhere. And again it led to loneliness even more, because you think that no one cares about you, no one wants to know that what is happening in your life. And mm, you try to hold those people with a fear that you'll lose them someday, but it uh, it goes in a different way. And that's the most difficult situation, when you feel abandoned or gaslighted, for that matter, in certain situations. So uh, all I want to tell is, if you ever feel that you find yourself in that dark room someday and you are not able to come out of it, I would request you all to please keep a helpline number handy, make it your wallpaper, or stick it on your drawing board, or where it can be visible to you, where you can just look at it and call someone in that crisis. Or start building a primary support system. Again, we are conditioned to think that support system, the primary support system, can be just family or friends, and but sometimes that can't be the case, and you lack that support. And as I said, I didn't know where to seek that support, where to go, whom to talk and all. uh, First thing, being honest with your therapist. And secondly, you can ask your therapist in what way you can build your support system for yourself, whether it can be your helpline number or your therapist itself. For me, it's my therapist. And then slowly, maybe uh, a group, you know a community where you can be vocal about it. You can have their numbers handy, or keep informed someone that what you are going through, and you might need that person uh, at that situation. Make that person aware of that. And someone who is dealing with someone who has who has suicidal thoughts or suicidal tendency again and again, and if you really care about that person, first of all, it's not a compulsion that you have to be there for that person. But first, don't negate or invalidate their feelings. Don't tell that they are trying to seek any kind of attention, because they are not. They are so hesitant to ask about help. At times they don't know the proper way to ask about help, and all they know is end that pain at that moment. And so either just you can tell them politely that you can't deal with that situation, and you can ask them to seek a professional support for that matter. And even if you care about them, even if you want to participate in any way, just try that you are getting that professional help in that matter. And as you are someone who is dealing with them, you can also seek that kind of support and ask a therapist that in which way you can help them, what all preventive measures you can adopt and everything. And make sure you are being there for them in person if possible. Most of the time, keep a check on them. If they might not always look sad and you know helpless and hopeless and everything, but maybe you know them better, that they are not being themselves, and they have been through certain things, or they have attempted these kind of things previously. So all you can do is keep a check on them time to time, ask them if they are feeling better, or how you can be for them in all this situation. And I I can't. Um, all I can do is I can post some contacts in comment section for helplines. If you, especially if you stay in India and you need those kind of contacts, you can definitely use those helpline numbers, and speak about it more. Be vocal about it. Don't be hesitant. Don't be shy about it. Or if someone is trying to invalidate your feelings, know that that's not the person you should talk to, but you can definitely get a support somewhere else, and you should get that help somewhere else. And hmm, I guess that's it about today's video. I'll I'll just post contact numbers in comments, and you can get it from there. So yeah, that's it. Bye.